When can I return to normal activities after colon surgery? If you have just had colon surgery, you might be wondering when you can get back to your normal routine. Recovery after colon surgery can vary quite a bit from person to person. It largely depends on the type of surgery you had, your overall health, and if there were any complications. Here's a general timeline of what to expect as you recover. In the first few days to 1 week after surgery, you will likely be encouraged to start light walking. This is important because it helps get your bowel function back on track and can reduce discomfort like pain and nausea. During this time, you will probably spend a lot of time resting as the sedation wears off. You might feel some mild bloating or cramping, which is normal. As you move into 1 to 2 weeks after your surgery, you should notice that any swelling and pain start to decrease. This is a good time to slowly increase your activity level. Light walking and gentle movements are encouraged, but it is still best to avoid any strenuous activities during this period. Between 2 to 4 weeks post-surgery, most people can return to basic daily activities. This includes light household chores and non-strenuous work. However, it is important to avoid heavy lifting and vigorous exercise during this time to prevent any complications. For those who had minimally invasive procedures, like laparoscopic colon surgery, you may find that you can resume most normal activities around 4 to 6 weeks after your surgery. If you had open surgery, full recovery might take a bit longer, but many patients feel significantly better within this time frame. If you are looking to return to strenuous exercise or heavy lifting, you might need to wait 6 to 8 weeks or even longer, especially if your surgery was more extensive or if there were complications. Always follow your surgeon's specific recommendations and make sure to attend follow-up appointments to check on your healing progress. It is essential to remember that recovery can vary greatly from person to person. Factors like the extent of your surgery and your overall health play a big role. Avoiding strenuous activities too soon is crucial to prevent issues like hernias or wound complications. Keep in touch with your healthcare team and report any unusual symptoms, such as severe pain or fever. In summary, most patients can expect to gradually return to their normal daily activities within 2 to 4 weeks after colon surgery. Full recovery and the ability to resume strenuous activities typically take 4 to 8 weeks or longer. Early mobilization with light walking is beneficial and encouraged right after surgery to promote healing and bowel function. Always consult with your healthcare provider for personalized advice tailored to your situation.